I am Marta. Just like Lindo mentioned, I'm part of the customer success team at Ability, the makers of SurveyCTO, and I will be here today to moderate the webinar session. I would like to welcome our first presenter of today's session, Lame. Lame Ungwang is an economics PhD candidate of the IMPRS research group on uncertainty and is based at the University of Jena, Germany. She is also a senior researcher at the International Security and Development Center in Berlin. And broadly speaking, her research focuses on applied microeconomics, development and behavioral economics, and she does work around entrepreneurship and microfinance with cross-cutting themes on gender and peace building. Welcome, Wame.
And hi, everyone. It's very nice of you all to join us today. Yes, I'm excited to share this ongoing work that was partly funded by SurveyCTO, so thank you again for that. And the working title of this study is Nudging Technology Adoption, Experimental Evidence on Menstrual Cup Uptake in Botswana. And just to give you an overview of what I will present, so the starting premise here academically is that there is this growing recognition that many individuals in especially low-income settings experience this phenomenon of period poverty. And that basically means that they're not able to afford sufficient amounts of the products that they need to manage their menstruation. And this has been linked in the literature to numerous negative impacts. So, for instance, in schooling for young girls, in labor markets, and for individual well-being. So it's a topic that's of high policy relevance. And what I wanted to do in this study was to examine whether the demand for new technology, the menstrual cup, could be spurred among potential beneficiaries. So this is a product that, unlike existing alternatives, could be very effective in addressing this problem of period poverty. And the specific approach I will use is a survey experiment. So I'm testing specifically whether two common policy tools can encourage the adoption of this technology in a developing country setting. So on the one hand, I wanted to look at the role of information framing. So here I look at the role of persuasive communication techniques in encouraging adoption. And then I wanted to look at the role of the choice infrastructure. And I'm specifically seeing whether a default nudge, so exploiting the endowment effect, could encourage technology adoption. And in the rest of this talk, I will motivate the topic a little bit further and then speak more specifically about the experimental design before presenting the main results and then showing some heterogeneous impacts of the two treatments. And then I will conclude thereafter. Okay. So the academic motivation for this study is that it's been well documented in many different domains that technologies with the potential to significantly improve individual welfare are underutilized. And we see this, for example, in healthcare with the use of anti-malaria bed nets. That's a prominent example. In agriculture with the use of high-yield seed varieties, for instance, and numerous other examples come from the education and entrepreneurship spaces. And there's therefore a lot of research to try and understand and consequently alleviate constraints on adoption towards facilitating diffusion and improving societal welfare. And in examining some of the causes of low technological uptake, the literature has attributed this pattern to credit or liquidity constraints or inaccessibility due to distance or geographical factors. So these are some of the more obvious explanations for under adoption of technologies. And then more recent explanations, which have been informed by psychology and behavioral economics, have revolved around non-pecuniary factors. So some examples here include informational barriers or a perceived lack of skills, technological uncertainty, or the idea that technology adoption might entail some type of cognitive effort. And all of this is to suggest that there is a potential role of non-pecuniary interventions as well in spurring technological take-ups. And here in the study, I wanted to test the effectiveness of two such interventions. So yeah, on alleviating constraints and fostering technology adoption. On the one hand, information framing could be seen as a way to inform individuals or lower technological uncertainty. And the choice environment could be seen as a way of overcoming cognitive constraints of adoption. And the technology of choice in this study, I argue, is interesting from a policy and an academic point of view. So policy-wise, as I've mentioned, it's increasingly reframed as a big concern that individuals experience period poverty. And just to give you some concrete examples, in India and in Kenya, legislation has been passed to guarantee universal product provision in all schools. And this is a costly and operationally demanding pledge to fulfill. And I argue then that the menstrual cup could be a promising tool for fulfilling such pledges because it's cost effective. So it's cheaper in the medium term. And while it does entail some learning to use efficiently, it offers numerous user-related benefits over existing alternatives. And the product itself is also interesting conceptually. So from an academic point of view, it's a technology that's used in a private domain. So even though the technology is superior, the benefits are unobservable to others. And in this setting, it's also completely unknown and unavailable locally. So it's a cleaner setting and an interesting setting to investigate the role of these two interventions overall. The domain and the product are relevant, and the product can address both normative and practical concerns for resource-constrained governments and for users. So to reiterate the question that I was looking at in this study, I wanted to investigate whether information framing and the choice environment affect the individual decision to adopt a new superior technology. And note that I'm abstracting from other relevant factors that are often examined in the literature. So credit constraints, I offer the product for free, and from peer effects or learning by looking only at the one-shot decision. Okay, now to get into the details of the study. So the methodology that I used here was a survey experiment in 3 different locations in Botswana, and I had a sample size of 610 adults who were given a small fee in the form of airtime to participate in the study. The questionnaire tool implemented in SurveyCTO collected information on menstrual history and experiences, participants' menstrual knowledge and perceptions or stigma towards menstruation, and I also collected measures that capture individual risk, personality, and socioeconomic and demographic factors. And important to note, given topic sensitivity, interviews were conducted in private with experienced local female enumerators. And during the interview, all participants received 2 key things. So first was information delivery. They watched a 6-minute video on sanitary health and menstrual products that are available to address sanitary health needs. And then they also received a free package of menstrual products. And here they could choose between 3 different products. So sanitary pads, tampons, and then the new technology in the study, the menstrual cup. And what is key to the design is that there's variation in the information frame that participants received. So half of them received neutral information about the menstrual cup, while the other half received persuasive information. So here I used persuasive communication techniques to try and encourage the menstrual cup to be seen as more attractive than the other options. And the second key variation in the study was in the choice environment. So as participants selected among 3 different products, they encountered different choice environments. So before the active choice, half the participants received their usual product, which was self-reported earlier in the interview, while the other half received the new product by default. So this is the default nudge treatment. And regardless of what product was assigned, they could then select their preferred product in an active choice phase. And what I was interested in doing then is testing the isolated impact of each intervention, so the persuasive versus and the default nudge, as well as that joint effectiveness. And just to show you the design very quickly in visual form, it's a 2x2 design where we have 4 groups in the end. So a control group and treatment 1, which is the group that received only persuasive information, treatment 2, which received only the default nudge, and treatment 3, which received both persuasive information and the default nudge. And the measures that I was interested in, so my main outcome of interest was adoption. So this was an indicator for having selected to take the menstrual cup home in the active decision phase. And I was also interested in examining heterogeneity along a few factors. And here I will present two. So first, period poverty, and this is whether a participant reports facing financial difficulties in affording their usual products. And then the second variable I was interested in looking at is the role of knowledge. So here it's an indicator for having been fully educated about menstruation early on, so prior to menarche. And I expect that both of these two factors affect the effectiveness of the treatment. And now the interesting part, the results that I found, which are still preliminary. So the first major finding is that adoption is significantly higher with the default nudge. So if you look at the likelihood of cup choice in this study across the 4 different groups, the first bar being the control and the last 3 being treatment 1, treatment 2, and treatment 3 respectively, you see that the default nudge led to significantly higher likelihood for both T2 and T3 participants. So those were significantly more likely to adopt compared to the control, as you can see with the size of these bars, while the role of persuasive information, on the other hand, was limited. And then to show some of the heterogeneous treatment effects, you can see here the role of period poverty. So the empty points are those who do not experience period poverty, while the filled in dots are those who do. And we see here that under all 3 treatments, those who experience period poverty are less likely to adopt than those who are non-period poor. And then the role of menstrual education also seems to matter, as we see here, that those who are fully educated about menstruation early on are more likely to adopt than those who are not educated about menstruation. So these 2 factors clearly affect treatment effectiveness as well. So I conclude by first summarizing the results I found. And first is that adoption behavior is strongly influenced by the default nudge alone, but there do seem to be significant complementarities between the default nudge and persuasive information, as the groups that got both of these interventions were significantly more likely to adopt. And then we also see that the role of period poverty is strong, but it contradicts what one might hope for from the policy dimension. So there is a weaker response by the period poor. And here I argue that it's plausible that adoption for them entails more risk. So giving up their usual product has a higher opportunity cost. And then with respect to knowledge and stigma, what seems to matter is menstrual education early on. And stigma, on the other hand, as well as risk preferences, the results of which I didn't show here, seem to have a limited, if any, role. And what all this suggests policy-wise is that the demand for the menstrual cup can indeed be curated with the use of behaviorally informed policy tools. But I also argue that policy responses should not target only product provision, but also menstrual education early on. And overall, the study is the first to document that product preferences, how they are distributed when participants are informed and given a full choice. And the setting adds significant heterogeneity to the studies that already exist on menstrual health management. And of course, it's worth noting that there is one major limitation in the study, which is why a follow-up study is planned. It is unclear if the adoption decisions in this study correlate strongly with actual adoption behavior. So we hope that it will lead to attempted and successful usage, but this is still to be determined. Okay, so this is a picture of my fantastic enumerators, and thank you all for listening, and I welcome all questions.
Thank you. Thank you so much, Lama, for your wonderful presentation and for sharing all these insights from your project. For now, I would like to present our second guest of today's session, Sally Zhang. She is a PhD candidate in economics at Stanford University. Her research interest lies in the intersection of development and labor economics, with a focus on understanding how household decisions affect the welfare of household members, especially that of women and children. Her current research documents hidden income in Indonesian and Kenyan households and studies its economic consequences. Welcome, Sally.
Thank you, Marta, and thank you for the SurveyCTO team for inviting me. My name is Sally Zhang. I am a PhD candidate at Stanford University, and today I'm going to present how I measure hidden income in a household survey. The motivation of my project is twofold. First, anecdotal evidence in developing countries shows that spouses hide income from each other, but there has been no empirical evidence documenting this phenomenon. Here are two quotes from focus groups that I conduct in Western Kenya. A husband says, "I cannot disclose my income because that's my secret. Reason being, if my spouse knows how much I earn, she'll demand for more than what I provide her with." A wife says, "Each person has specific responsibilities to cater for in the household. Therefore, exposing my exact income could put me at risk of being given more responsibilities to cater for whenever I earn more than what I'm supposed to cover." The second motivation is from a survey design standpoint, which may be particularly of interest to this audience. One reason that no empirical evidence of hidden income exists is that it is challenging to measure hidden income, especially in traditional surveys where only one individual is surveyed in a household. In such surveys, such as the CPS in the United States, a single person answers questions about everyone else in the household, so it is impossible to know whether others will agree. In other surveys, such as the DHS and the Living Standards Measurement Survey, the current best practice of survey design attempts to collect better quality data by asking each individual to answer for themselves. My survey builds upon both the previous methods by asking each individual to both respond for themselves and to answer questions with regard to their spouses. This contributes to the literature in two ways. First, my project provides direct evidence that the identity of the survey respondent and the privacy of survey conditions matter. And second, this design allows us to measure disagreement in a household, and I use this disagreement to infer hidden income. Before I continue with today's presentation, I'd like to give you an overview of my entire project. Due to time constraints, we're only going to focus on a part of the project in today's talk, but if you are interested in a full project, you can contact me for the working paper, or it will also be uploaded to my website in October. So in my project, I answered 3 questions. First, do household members hide income from one another? To answer this question, I used both primary data collection from Kenya, which is the focus of today's presentation, and also a nationally representative survey from Indonesia. I find similar results in both datasets, suggesting that the survey methodology that I'm presenting to you today is externally valid. In my paper, I also answered the questions of how hidden income correlates with real-life economic outcomes and develop a household model that explains the existence of hidden income. I'm happy to answer any questions about the other parts of my project as well in the Q&A session. So going back to today's presentation, I'm going to present 2 results I got from survey data from 575 married couples in Western Kenya. I did the collection earlier this year. Eligible couples are monogamous, live together, and both have income-generating activities. In my survey, each individual's income is elicited 3 times. First, each individual is asked, "How much did you make in the last 7 days across all your jobs?" Each individual is also asked, "How much did your spouse make in the last 7 days across all of their jobs?" Each respondent provided these information in private, and privacy is ensured by physically separating the couple during the interview process so that they cannot see or hear each other. Lastly, couples are reunited after the individual survey is complete, and I ask each individual again, "How much did you make in the last 7 days across all jobs?" This time in front of their spouse. I hypothesize that if individuals hide income, spousal estimates of income will be lower than individuals' self-reports, and individual self-reports in front of their spouse will also be lower than individual self-reports in private. This is exactly what I find. This graph shows you the distribution of log income in the last 7 days. The red line is the distribution of self-reported income in private. The dark blue line is the distribution of spousal reported income. The light blue line is the distribution of self-reported income in front of spouse. Remember that these distributions are using the same sample of individuals, and the wording of the three questions are exactly the same. You can see from the graph that the spousal estimates and the self-reports in front of spouse are lower than individual self-reports in private. After controlling for individual fixed effects, I find that spouse-reported income is on average 20% lower than the same person's self-reported income, and self-report in front of spouse is 17% lower than the same person's self-reported income in private. I see similar distributions in additional outcomes, such as both income in the last 7 days that I showed you, and also income in a typical week. You also see the same patterns when I ask about savings in the last 30 days and transfers to extended family in the last 30 days. You may be concerned that the difference in reports reflects measurement error or misreporting to surveyors instead of hidden income. For example, I asked the same individual the same question twice. This is an unusual way to collect data, and that in itself may cause the individual to give a different report. To alleviate this concern, I use two placebo questions that are asked in the same way. If it is the survey structure that causes the reports to differ, I would expect to see the same pattern in a placebo question. The first placebo question is, if you're walking by yourself, how many minutes does it take for you to go from your house to the main road? So again, this question, we elicited a self-report in private, a spousal estimate in private, and a report in front of spouse. For this question, you see that all three reports are extremely similar to each other. The second placebo question is, how much money did you receive from your spouse in the last 7 days? Again, we do not see spousal underestimation or underreporting in front of spouse for this question compared to the pattern you see for the income in the last 7 days. You may also be concerned that differences in reports reflect misreporting to the surveyor. For example, if a boasting individual overreports their own income and truthfully reports others' income, this can generate a similar pattern as if they are underestimating others' income. To address this concern, I constructed a social desirability index in my survey and showed that it is not positively correlated with results. One mechanism behind misreporting may be to conform to the male breadwinner norm. In my data, wives underestimate income of husbands who already earn less, and these husbands also underreport income in front of wives. This is not consistent with misreporting in order to conform to the male breadwinner norm, although I don't rule out that male breadwinner norm can actually be a mechanism that drives income hiding. So to sum up, why is measuring hidden income important? Firstly, in the rest of my paper, I will show that hidden income has potentially important economic consequences. When income is hidden from wives, children in Indonesia are more likely to be underweight for their age. When I track these children into adulthood, I find that girls continue to be underweight and boys are less likely to be employed. Meanwhile, hidden income from husbands is not correlated with worse child outcomes, so hidden income also has a heterogeneity aspect by gender. Second, my paper shows the importance of surveying multiple individuals in the same household. For example, in Kenya, the median wife self-reported income is 47% of the self-reported income of the husband. However, a median wife self-reports earning 60% of what the husband earns, and the median husband reports that the wife's income is only 35% of his own income. As such, the identity of the respondent can matter for accurately measuring poverty and inequality in households. To conclude, spouses in Western Kenya report 17% lower income in front of partners, and spousal estimates are 20% lower than self-reports. This is consistent with hidden income in the household. It also shows that surveying one individual per household can lead to biased measurement of poverty and intra-household inequality. In addition to my full working paper on measuring hidden income, I also have ongoing research using a lab in a field experiment to disentangle mechanisms and consequences of hidden income. Thank you for your attention, and I look forward to your question.
Yeah, thank you so much both for wonderful presentations, wonderful projects, for sharing this with us. I'm sure that a lot of people learned a lot from this webinar session. So thank you.
Thank you, Marta, for hosting, and thank you everyone for attending.
Bye.